Hello, my name is Samantha Olds Frey, and I'm the CEO of the Illinois Association of Medicaid Health Plans. Thank you for joining us today on IAMHP's Executive Corner. We're going to talk about healthcare disparities, social determinants of health, and data, and how you can weave those together to improve health outcomes and to better serve either patients or really a whole population, such as the Medicaid program. With the onset of COVID-19, gaps and disparities have only grown wider and become more of a topic of discussion, which is why we want to focus on this and really talk about how we can improve health outcomes for specific people and populations most impacted by COVID-19, and really make sure that we're making decisions based off of data and analytics to address those social factors and those social determinants of health. But first, it's critical to understand why social determinants of health and social factors play a role in health outcomes. And it really just drives down to the basics that it is your health. 80% of your health as an individual is determined by social factors and social determinants of health. That is what both true for you as a person, but also for a population. And so whether that be a community, a neighborhood, or an entire state, the social factors and social determinants of health play a role 80% of health outcomes. And so when we think of clinical interventions and we think of how do we interact with patients, perhaps in a doctor's office or at a hospital, you're really only impacting 20% of a patient's care. The rest of that is happening outside of a clinical setting. And that's going to be things like the neighborhood in which they live. Do they have access to childcare? Do they have access to transportation? Do they have access to fresh food? Or is it safe for them to exercise in a regular manner? What are the stressors and the trauma in which they experience on a daily basis? And how does that all play a role in how they interact and interface with the healthcare system? And so with the fact that those components, those social determinants of health and those social factors play such a large role in health outcomes, there's really no way that you are going to meaningfully address and improve health care without dealing with health outcome or without dealing with social factors and social determinants of health. And so how do you incorporate those into both population health and patient care? The first thing, of course, is going to be very basic: health risk screenings and health risk assessments. What does that mean? It means you ask people, what are the things you're dealing with? Or do you have stable housing? Do you have access to fresh food? What are the things that are, what barriers are you facing as an individual in interacting with the healthcare system? And so that's the initial front line. But we have to think that that alone and realize that alone is not enough. And that's because if you are interacting with a patient, either in a doctor's office or as a health plan member, if you're interacting with the people that you're able to reach and who are often most engaged in their healthcare. So you're just getting a tiny slice of the population as a whole. And so you have to augment and offset sort of that to create the full picture of the population you're serving. And we do that through data. We do that through sort of collective data like vaccination data. We do that through social determinant of health data. Where are the grocery stores and neighborhoods? Where are the bus routes and the train stations? What timing does it take? Where are the closest doctor's offices? What is the violence and other trauma in these neighborhoods? So we take that all into account. We also look at things like HEDIS data, both again from an individual perspective. Has somebody gotten the vaccinations that they need? Has somebody seen their doctor for their diabetes? But then also collectively, HEDIS gaps and data for certain neighborhoods, zip codes, etc. And so we look at that and weave that all together at the health plan level using tools like 3M to create plans and strategies and interventions to improve health outcomes in a holistic manner. Because again, if we're not taking into account those social factors and we're relying on clinical interventions, we're only impacting 20% of healthcare outcomes. And we're also only reaching those who are most engaged in their healthcare outcomes. So we're going to use this data, this holistic approach, to not only treat high-risk members and not only improve the care for those who are most vulnerable, but we're also going to use that data and that information to assess what is often referred to as rising risk. where are individuals that are going to be low risk or moderate risk, but are facing certain social factors or healthcare factors that are going to potentially push them into that high risk category? And what can we do both at a health plan level, but also at a clinical level to sort of assess and treat that member, intervene, and potentially decrease the potential for that rising risk to become high risk members? So that is how we are taking into account social disparities, and how we are trying to intervene and create a healthier population and improve health outcomes, not only at that individual level, which is critical, but for communities as a whole. Thank you so much for joining us today on IAMHP's Executive Corner. To learn more, check out our Care Coordination podcast series and our podcast episode with trusted partner 3M, focused exactly on this topic: integration of clinical and social risk for improving health outcomes. Thank you.